Hello, my name's Rayanne. I'm the infant feeding lead here at the Royal Berkshire Hospital, and I just want to take this opportunity to talk to you a little bit about responsive feeding. So responsive feeding is what we recommend for all babies, however they're fed, whether that be via a bottle or whether you wish to breastfeed. I want to explain how we respond to our babies by looking for feeding cues. And actually, when your baby is first born, they display these feeding cues quite soon after they're born by putting their hands to their mouth, rooting, which is turning towards a stimulus, either a finger on their cheek or the covers. And this is the baby wanting to turn towards the breast. More subtle signs later on, maybe when your baby's asleep, but you can see their eyes moving behind their closed eyelids. And if you're waiting for that baby to wake up and thinking the baby should be feeding, then that's the time to pick up a baby and put that baby skin to skin with a view to feeding. It might take the baby a while to rouse, to be ready to feed, but actually we don't recommend leaving the baby to cry. That is, we know, is the last stage of hunger, and it makes it a lot more difficult for the baby to attach to the breast if the baby is crying. And then you feel stressed, the baby also gets more stressed because it picks up your anxiety. So it's much better to do this in a calm way. If the baby's going to the breast, we need baby to bring their tongue forward, and if the baby's crying, the tongue's up to the roof of the mouth. So it's really key to look out for those feeding cues. If you look in the magazine that you're given when you were first pregnant, there's a magazine called Mothers and Others, and there's some lovely little pictures of typical feeding cues. So we not only recommend that you respond to your baby, we also think that it's really important to respond to your own body. So certainly if your breasts, when you have an established supply, start to feel full, then it's better to remove some of the milk. If the baby isn't ready to feed, obviously that's the easiest way to remove the milk, is have the baby do it. If the baby isn't ready to feed, then it's definitely a good idea to express a little bit of that milk, because by taking that milk off, you're ensuring your future supply. So you don't only have to respond to the physical signs your body's telling you, but also how you're feeling. And if you feel that strong need to hold your baby or to put your baby to the breast because it feels nice, because your baby is unsettled and you're wishing to comfort your baby, that is all part of responsive feeding. Equally, when, weeks down the road, when you have places to go, things to do, and it suits you to feed your baby before a journey, that also is fine. So most babies will respond if you put them to the breast, and that is exactly what a successful breastfeeding mother does, is uses breastfeeding to fit in with her lifestyle. The same also goes for expressing. If you're expressing your milk and giving via a bottle, responding to how your body feels and what's going on in your life might be much more successful way of removing milk than going by a schedule. Certainly with a baby, babies can't tell the time. They don't care whether it's 3 in the morning or 3 in the afternoon. So actually responding to them when they are hungry, when they are showing you those signs. Babies have periods of time where they feed quite frequently, and other times where they're much sleepier. It will take you a while to get to know your baby. We, as a rough guide, we expect after the first day when baby is born, The baby may be sleepy, but after the first 24 hours, we would like at least 8 feeds in 24 hours, but we wouldn't expect them to be at regular intervals. Some might be a few close together, then the baby might have a longer gap.